one of the commonest use, and about 2% of these people cannot tolerate statins.
Why so?
Because they cannot, they have a problem. So if you give them these, then they will get unbearable severe weakness and leg pains, especially more in the legs, also in the hands.
Okay, and who are those some people, like meaning some categories or something, age wise?
Age wise, these people will be little after 40,
40,
having high cholesterol, or having a heart problem, or having a stroke. And ह्या चारही category. So one of the common drug that is utilized or used is this statin म्हणून. Okay, it's a very, very commonly used drug. So if somebody gets those pain, they must go to the doctor and find out, is it because of the drug?
I see.
दुसरो ड्रग असा मी एक डायुरेटिक्स म्हणून, म्हणजे पिल्ल घेना फुडें तुका युरीन चड पास जाता. When somebody is bloated or leg swollen or heart is failing, we use this, or blood pressure, we use this drug called diuretics. So तितून एकदा तो टॅबलेट घेतले काय ना, you pass more urine. Along with urine, urine is not just water, न्ही त्याच्या बरोबर सोडियम गेलो, पोटॅशियम गेलो, so many things are lost. So the body is deprived of this, and you have an electrolyte imbalance. And then this is how these diuretics can give you severe leg pains, very, very severe. So when you go to the doctor, doctor has to look at this and treat your problem rather than just give something for the legs.
Correct.
Okay. So now why I am telling all these things, it is for us to understand leg pain is not something very, very simple.
Correct.
The best tired and fatigued and it is not just fibromyalgia. It can be something very, very serious. Okay.
Correct.
Many times you have a disc prolapse here, the nerve gets compressed and that nerve goes down. If that nerve is compressed, wherever the nerve goes, you get pain. So हांगा disc prolapse चलता चलता तो उखलता, you try to lift something and कसं
Exactly.
फाटीन आयले म्हणटा. फाटीन येवन पायान कित्याक दुखता? Is because that disc which is prolapse is pressing the nerve which is going to the leg. So this is a very common thing. This is called as a prolapse intervertebral disc or a herniated disc. There are other problems in the spine which is also called a spinal canal stenosis. Canal भितरल्यान स्टेनो जावन spinal cord बंद जाता. And sometimes tight, थोडे muscles, irritable muscles असता. No? Like in a class, there's always one boy who is going to be hyper or irritable. They muscle at the smallest call, these muscles go into spasm. Okay. There's something called as a pyriform syndrome. Okay. So it is this sort of hyper excitable or hyper irritable muscle. Once they go into spasm, they'll press everything, including the nerve, everything odun yata, and then you get this very, very severe pain. And the most common म्हणतात ते आमचे cramps येतात. Suddenly पाय वैग्या करतो घट्ट जाता पाय.
म्हणजे एज इफ भितरल्यान कोणी असे ओढल्याला बसून तेंका.
That is called cramp. That basically comes number one, आता तू चलत जर रावलो, you first time you are walking, 5 मिनिटं झाली की you start getting cramps in the leg. That is, when you do any work for the first time, your muscle is not used to that, so you get the cramps. Fatigue, tired झालो muscle after you run a race, then you can fall down with that cramp because they go into such a big spasm. Electrolyte depletion, imbalance, like you have a loose motion, you lose electrolytes. You go out in the sun, you sweat, you lose electrolytes, and then you come back and with such severe, very, very severe pain, dehydration. So these are some of the muscle cramps that keep on happening there. And sometimes your leg may not be perfect, both legs may not be perfect, one leg shorter than the other.
Correct.
You have a problem. Okay, one leg a little tighter and one leg straighter, you have a problem. Sometimes legs are like this, sometimes legs are like this. These may be before or following some diseases like leprosy, neuritis. Okay, subsequently or people may be born with the defects, or they might have developed the defect halfway. Or later on also. Okay, there are various calipers we give them, so you can just fit them so that balance आमच्या बॉडीची बॅलन्स आम्ही 4 सायडीनी पायाचे असे उडोवंक जाय.
बरोबर.
माझी जर बॉडी 50 किलो असली देन हेवटेन 25 हेवटेन 25 किलो येले. सो हांगा 12 किलो हांगा 12 किलो येले. So when the weight is transmitted to the body, it is transmitted from 4 different positions. So
I
at एका पोझिशनचे 12 किलो.
ओके.
स्प्लिट करून जेन्ना बॉडीची वेट जमनीर वता न्ही, ओके, तेन्ना इट स्प्लिट्स डिफरंटली. सो प्रत्येक पॉइंटाचेर 12 किलो इज नॉट अ बिग थिंग. सो ते कंप्लिटली 50 किलो जर बरोबर येत देन इट्स अ बिग थिंग.
But people do not know about it. People are
have
so
to.
ignorant like. आणि आम्ही कितें आता घराकडे जे कितें अवेलेबल आसा मातशे दुखले की अप्लाय केले. इट मे बी एनी लोशन or something
Anemia
like
will
that.
have a problem.
Yeah.
Diabetes, everybody has a problem.
Yeah.
So many diseases, legs are cut. Parkinson's, you have a problem.
बरोबर.
Kidney failure asat nala. You have to be very, very careful.
Okay.
And there is sometimes a nerve gets damaged. That's called peripheral neuropathy.
Okay.
So also now we have a cancer patients. A
बरोबर.
lot of cancers are coming up this day. They have a problem. And routinely आम्ही जाता पळय तांकां म्हणटा ते chronic fatigue.
Yeah.
पांय मातशे वायट दुखता मातशे. आनी युजली मागीर आमकां संवय जाली काय ना मातशे चड कंप्लेन करपाची. कंप्लेन जाता.
Okay.
Now the thing is, how do we manage this?
Correct. Very much.
एक म्हणजे पहिली म्हणजे if you पहिली म्हणजे you go to the doctor and find out if you have any one of these problems that I've tried to
Okay.
show and tell you right now. दुसरे simple thing, एक बालदीभर उदक घे, पाय बुडोवन दवर. If there is nothing, if it is simple chronic fatigue syndrome, पाय त्या गरम उदकान बुडोवन दवर as much as you can tolerate. It should not burn
Okay.
your leg.
Yeah, correct.
But it should be sufficiently hot. If you lift your leg, you'll find how much it becomes red. That means more blood has gone there. So if the leg gets more blood, obviously it becomes more fresher. After that, you can do a little bit of massage with some oil or with some lotion or a pain killing lotion or anything, cooling lotions. That's good
Cooling.
meta.
Yeah, बरोबर.
And then go to sleep. You will get a very, very good sleep. So a
Yeah.
little bit of massage. Oil, one of the simple oil, if you use coconut oil, it's good enough.
Yeah.
And this the coconut oil, you can even boil it. Heat the coconut oil, then apply it. It's superb. It gives
Yeah.
a very good improvement into the this. Okay.
बरोबर. But
Beside-
it is very short term. What do I say?
At that moment,
ways.
at
At
that
that
moment,
moment.
at that
Correct.
moment,
Correct.
when it is
But
paining.
if you want to get a long term relief, then you
There are
must consult a
There
doctor.
are many, absolutely. We use many things like vitamin E, we use calcium, we use vitamin D, then pregabalin, another vitamin, then muscle relaxants, thode drugs that we use, okay? Or we will ask you to change you use very soft cushion sleepers.
Okay.
आता very soft येता पळय.
Under the leg. to
Under
keep.
the leg.
Yeah.
Or in your shoes, put some cushions. There are some good stocks also coming.
Correct.
Socks येता. Thick socks येता. We call them, and they are available today as diabetic socks.
Correct.
Okay, diabetic patient हे common is ne. So if you put that sock, they get that little warmness, they get a better blood supply, and they feel it much better. Or you get shoes on galpagat bare soles meta. These are all that can be used through this. Or little simple exercise. When you are sleeping, stretch your legs for 5 minutes. When you are getting up in the morning, stretch your legs for 5 minutes. Stretching is one of the best exercise. And if you look at most of our yogas, what do? They stretch every joint.
Correct.
Okay, when you stretch them, and then release them, the muscle gets toned up better. So simple stretching helps you. Many times footak we do use some calipers, okay, and one of the important thing that you have to remember is if you are depressed, many of us are depressed.
Yeah.
Okay, unless you treat your depression, this could be one of the manifestation of depression.
Depression.
Okay, so that needs to be treated properly. And the most important is strengthen your legs. Do sufficient exercise. Always look after your legs. Keep them flexible. Keep them strong.
बरोबर.
And if you do that, I'm sure they have got a lots to do. They are able to stay with us for throughout our life. Okay, so that's the most important thing that I would advise everyone to do. Just look after your leg. पायाचे लक्ष दवरा.
बरोबर.
Strengthen them. clean them. Nakta cut करताना सारखी properly nakta cut करताना we can damage it or we leave it differently so that they grow inside the toes. Ingrowing toenail म्हणता पळय ते. So they grow quite inside and then it gives infection into the legs. So all these things need to be slowly taken care of. And if you really look at the legs, I'm sure we can definitely take care of our legs and keep them through 100 years that we want to live.
Correct.
One of the simplest thing is you just go close to this, put your legs on the wall, just lie down there for 10-15 minutes. You will find tremendous relief into the day's fatigue into your legs.
Correct.
You can do, there are many things that you can do.
Yeah.
But we should bring it into mind. I'm takle nadung there na baba. I want to keep my legs healthy. And we need to look at the legs, okay?
Correct.
It's only these sort of things, if we go ahead and do it, I'm sure nothing should go wrong with your leg.
Okay.
After cutting one leg, whatever artificial leg I'll give you cannot be like your original leg. It's just not possible.
Correct.
I think that is the way we should do it. I think we have finished most of the time into the question itself today.
Correct. आज आम्ही एकूच प्रश्न घेतलो आणि डॉक्टरान इतले इलेबोरेट तुमकां माहिती दिली. खरें तर माझ्या ज्ञानान भर पडली, कित्याक नॉर्मली जशें हांवें म्हटलें तशें की घरान जे कितें अवेलेबल आसता तेच लावन आमी ओके जालो पांय सारको. पण आतां जितले तुमी डीपली जे सांगला पळय म्हाका खरेंच दिसता की पळोवप्यांकूय तांकां बरेंच बेनिफीट जाला आसतलें. तुमी मुजरत तुमचे प्रश्न आनीक कितें आसा ओ वॉट एवर रिलेटेड टू युअर हेल्थ एंड लायफस्टायल तुमी आमकां मुजरत प्रश्न धाडचे. आणि आता टायम जाल्लो आसा आणि ही कार्यावळ आज आमकां हांगाच थांबोवची पडटा. तर परत मेळुया येता त्या शुक्रारा रातचे 10 वरांचेर. पळयत रावा अलर्ट एक्टिव्ह अलायव्ह एट 100 ऑन प्रुडंट. नमस्कार.